Right now, we are getting into another conversation. This is the conversation which concerns each and every one of us. We know Valentine's is in the corner, and Valentine's is all about gifts, loving. It's a season of flowers. It's a season of everything beautiful and everything red. But at the same time, people express affection in different ways. And Valentine's is one of the times people express affection a lot. And like I said, it's in different ways, but it's actually very important for us to, express this affection and love responsibly. The word here is responsibly. And that is why we're about to have a conversation about responsible sex. And this has to do with HIV. So in the studio with us is the head of prevention, counseling and nutrition, NACP at the NACP, National AIDS Control Program. And her name is Caroline Adonadaga. Of course, you are welcome to the show.
Thank you.
We had a nice conversation outside, but it's time for us to bring that conversation in the studio for our viewers to also enjoy. And this conversation, I would say, is my Valentine's gift to each and every one of you watching. As my Valentine's is Jesus and he's giving me the gift of life, I'm giving you the gift of education right now when it comes to the issue of HIV. So let's get straight into the conversation. And first of all, what is HIV?
Okay, thank you very much.
You're
Good
welcome.
morning to our viewers. When you say HIV is the name of the virus that causes AIDS in humans. So it's just like the way I'm Caroline and then you are Chris, yes. That is the name that is given to the virus that causes AIDS in humans.
Right.
So it's simply the name of the virus that causes AIDS.
All right, so there are two types of HIV. What are they? And how do you differentiate them?
Okay, so for HIV, we have two strains or two types. We have the HIV type 1 and we have the HIV type 2. They are both HIV. Okay, they all progress from infection to AIDS.
Yeah.
Okay, but the difference between the two is that with the HIV type 1, that one is a bit more virulent, as in when you get HIV type 1, progression virulent. Is it okay? So it's a bit more aggressive than the HIV type 2. So when somebody gets HIV type 1, progression from the infection to AIDS is a bit faster compared to the HIV type 2.
Right.
That one progresses slower than the type 1.
Yeah.
Okay. And then for the type 2, it is rarely transmitted from an infected mother to baby.
Rarely.
So if you have a pregnant woman with an HIV type 2, transmission is possible, but it's rare. It's hard for that, but with the type 1, it's easily transmitted.
Right.
Okay. And then when you are looking at the similarities is that I said earlier they are both HIV. They will both, the mode of transmission, the way you get HIV type 1 is the same way you get HIV type 2. And then another thing is that the signs and symptoms that you will show when your immune system is weakened, they are similar signs and symptoms. Sometimes we call them opportunistic infections.
Right.
Opportunistic infections in the sense that they take opportunity of the fact that your immune system is weak for you to suffer those diseases. Yeah. And so those are some of the things about
All right,
HIV
so you talked about mode of, okay, before we get into the mode of transmission, you talked about the types. What, when we talk about Ghana, right, which type is more?
HIV type 1.
Type 1?
Yes.
Here?
Over 98%. Yeah.
So wait,
of
type
those who are infected
type
have
1 is
the
a violent
type
one?
Yes. HIV type 1. But they are the same. But now it's not that much of a difficulty.
Right.
At the beginning, treating type 2, even though we had very few people having it, treating type 2 was a bit difficult. But now we have newer medicines that regardless of the type of HIV you have, at least the medicines do work.
All right. So what are the mode of HIV transmissions? Like, earlier I started about, I started the show with talking about responsible sex, and for the fact that Valentine's Day is just tomorrow, a lot of people show their affection in different ways, or sometimes they just even want to, feel part, they want to be part of what is going on. That's the special day, and they just lose themselves, irresponsibly. But there are other types of modes of transmission. Can you share?
Yeah, for mode of transmission, when we say mode of transmission, we're just talking of how one can get the infection, which is the HIV infection. So the commonest one is from through unprotected sexual intercourse. That is having unprotected sex. Yeah. You have sex without using condom or protection with somebody who is HIV positive. You can get HIV through that. And then another way is if you share sharps or inject drugs. You know, we have people who inject these hard drugs. And the issue is usually the person they're looking for the vein. And once you get it, they have to draw to find out whether it's inside. And then, so if there are about 3 or 4 sharing that syringe with that drug, the first one is positive, the rest will get. And then we also have another way is from an infected mother to the baby. That is, if a woman is HIV positive and she's pregnant, she can transmit this virus to her child, either during the time she's pregnant, when the baby is in the womb, or when she gets into labor and then she's about to deliver, or after delivery if she gives the baby the breast milk.
Oh, so at any point
At any point, these 3
So it can
points.
be during conception, and during breastfeeding, or during giving birth.
Oh, wow. So those are the modes of transmission.
Right. So what's the difference between HIV infection, and AIDS?
And just as I mentioned earlier, when you talk of HIV, we are just looking at the virus that causes AIDS. So it's just the name of the virus. But then when you say somebody has HIV infection, it means this person has engaged in either an unprotected sex with somebody who is HIV positive or any of the other modes and gotten the virus in the blood. So now we say that this person has an HIV infection. And then for the AIDS, it means the person with the infection, the immunity has been weakened by the destruction, through the virus. And so the person now begins to show signs and symptoms of the disease. Okay. The difference between the one who is having an HIV infection and the one who is having AIDS is that for the HIV infected one who is not having AIDS, that person is, any of us can be HIV positive. Nobody will know. You can look at the person's face. The person is healthy, walking around and doing his or her work. But then that person is infectious, can infect other people. The one who has AIDS, that person will be sick, showing signs and symptoms of different illnesses at the same time, where we refer to it as a syndrome. And that person too is infectious. So one is sick, one is not sick. Okay, so that is the difference.
So what is the window period when talking about HIV?
Yeah, so with the window period, when you are dealing with HIV, when somebody gets infected today, and then that person goes to do an HIV test tomorrow, or a week's time, or 2 weeks' time, or in a month's time, the person may test negative for HIV, even though the person is HIV positive. And it is because the test kits we are using, we are looking for something we refer to as the HIV antibodies. Antibodies are antigen specific, so the germ will have to enter into you and then induce the body to now produce those antibodies, which the test kits are looking for. So, and depending on the individual, there are some people, when you get it, by 6 weeks, the body would have produced enough antibodies such that when you do the HIV test, it can pick it. Some people it will take 1 month, but averagely it takes between 6 to 12 weeks. So that period within which somebody is HIV positive, but will test negative when the person takes the test, is the period referred to as the window period.
So would we say it's because of the window periods that we are asked to always test? Always test?
No, they always test. In fact, we recommend yearly testing for the general population. But we talk about the window period because if you engage in a risky behavior today, and then you go to do the test, or like I have brought
or maybe get raped or something.
Or if you get raped, whichever. The issue is you are infected. Now you go to test, because by that time you don't know you're infected, but you have engaged in a risky behavior. You get to the facility, they counsel you, they do the test. But in the course of the dialogue, the counseling, you tell me, who is a counselor, that you have engaged in an unprotected sexual behavior, and then I test you and it's negative, because I have this at the back of my mind, I will tell you that, and I would have also explained it to you, that look, because of this, it is possible you are infected, but your body hasn't produced enough antibodies. So let us wait till 3 months. Come back in 3 months, and then we'll retest. By then, you would have seroconverted. By then, the body would have produced enough antibodies to be detected.
Right.
Okay, and then I'll tell you that once you go and you are waiting, you either don't engage in any other risky behavior, or if you must have sex, you use protection, so that when you come, we know your purpose. So window period simply is a period when somebody is HIV infected, but the body has not produced enough antibodies to be detected during the test. So infected, viral load is very high, but the person will test negative.
Wow. Even though the viral load can be
that
high.
time, the person is very infectious, because viral load is very high. Body is still trying to put things in check. I mean, gather its fighting forces to try to contain the virus. Okay, and in doing that, the antibodies are produced. Right.
So, from what you said, you know, there are times that there are so many times that I've heard that if someone, say, engages in an activity that it's not healthy, or, you know, a careless activity, or probably get rapes or something, they tell them to go to the hospital to take certain medicines. So what are these medicines?
Okay. So if somebody gets an exposure to HIV, either the person engaged in an unprotected sex, like yesterday somebody went and engaged in unprotected sex with somebody's status you don't know, or you suspect is HIV positive, what you do is you go to the health facility, and then they will counsel you, they will test you for HIV. Okay, if you are negative, then we now give you what we refer to as post-exposure prophylaxis.
Right.
Okay, and that one, if the person must take it, the person must get to that point where the person will get the facility within 72 hours.
Within 72 hours.
If you go after that, it will not work. But the key thing is you must be tested first for HIV. We have to be sure that you don't have the infection already. Because if we test you are positive, it is not because of
that thing that happened.
Because the window period is there. So you couldn't have tested positive immediately after that. So we have those medicines, and they are available, but just that you have to go through a process of testing and all that.
So if you go through that process, can everything be done within that 72 hours?
Oh yes. In fact, post-exposure prophylaxis works best when it started within 2 hours. Okay. But it can be taken within 72 hours. Okay. So once you go, before we are taking you through that, which can be done within a day, we'll start you with the first dose. Right. Okay, and then we'll go through that. Once you agree to go through the process, it's just the testing and counseling. And once you are negative, we give you the medicines for 1 month, 28 days. They are tablets, some of the ARVs, then you go and take. Right.
So can you know someone's status by just looking at them?
No, you can't look at somebody's face and know whether the person is positive or not.
You know, when you look at someone that has malaria, or someone that's like tired and weak.
Now with HIV, you need a diagnosis. You need to do an HIV test. The person must go through the testing process, and then if the person tests positive, because so there's no way, it doesn't matter how lean, how sick the person, it's only an HIV test that will. All right, for doctors sometimes there are certain things that may show in somebody that a doctor will suspect, but until the test is done, the doctor cannot. Even the doctor cannot say that the person has HIV without a test.
So what kind of tests do we have available?
Yeah, in fact, the test can be done either using the self-test kit, which I brought here. So you can, these ones, I'm sure everybody here will pick them. And then those living close by, please, if you need one, come in here and then pick one, and then you go. The instructions are there as to how to do the test. And so somebody, you can do this at the comfort of your home. Yeah, that's why it's referred to as the HIV self-test kit. Yeah, so because you do it at your convenience. And then once it's done, if there's a need for you to now go to the facility, you look at, in fact, all the facilities around they do this test. You decide which facility you want to go to, and now they complete the algorithm for you. And then aside this, you can also visit any of the health facilities.
And do the blood test.
Yes, so when you get there, look for the counselor, wherever, and then they will take you through.
Right.
That one, they will finish the algorithm there, tell you whether you are positive or negative. Yeah, so that if you are positive, you are put on treatment.
Yeah.
If you are negative, we put you on prevention interventions that you have to take so that you don't get infected.
All right, so how much does it actually cost?
HIV test is free in Ghana.
Oh, you could just walk in any
Very
gas
free,
station.
yeah. It's not, the test is free. In fact, all the services are free. The test is free. If you are positive, treatment is free. Viral load monitoring, everything about HIV for now is free. All you have to do is to avail yourself for the test to be done. After that, we take it up from
Right.
there. Yeah.
Is it curable?
HIV is not curable. The infection is not curable.
Right.
You can't cure HIV. So once you get infected, know that you are going to be on medication for the rest of your life.
Okay.
But there is management or treatment.
Yeah. So it's more like, I'm going to compare it to, say, if you have diabetes, you were taking medicine all your life.
Yeah. So it's now like one of those chronic infections.
So it's like a lifestyle.
Yes.
thing.
So you have, you know, the diabetics, they take their medicines every day, and it's for life.
Yeah.
Somebody with hypertension will do the same.
Same thing.
And
Blood
then
pressure?
somebody with HIV, blood pressure is the hypertension.
Yeah.
So they were, and then the one with the HIV too now, the infection is like a chronic, one of those ones. So you have to take
I
it
asked this
daily.
because it's important that we have this conversation so people stop stigmatizing others. You understand? Because people feel like the minute you start taking a lot of medicines, or maybe you have HIV, everybody has to start running away from you. But at the end of the day, there are people out there that have other health issues where they also have to take medicines all their life after that.
So that's why now HIV is no longer as it was. You know, previously there was no treatment, and so once you get it, it's a death sentence. But now, to God be the glory, we have the antiretroviral treatment using the ARVs. That's the antiretroviral, the medicines that we use. So that is no longer a death sentence.
Right. But how can, like, how long do people that are taking their medications stay for? Like, let's say persons living with HIV.
Yeah.
How does the medicine work? At what point, like, do they ever stop? Does the viral load come down? What is it?
Yeah, so once you start treatment, it is for life. Because I said it's not curable. You are managing. And so the medicine is supposed to keep the virus in check so that it doesn't multiply. It's as it's multiplying that it is destroying your immune cells so that you become weak. So you start the medicine, you have to keep taking it for as long as you live until we get a cure, which we do not have currently. Okay. Yeah, so that is where we are now.
Okay.
And then you have to monitor your viral load. And HIV treatment is such that it's not like paracetamol. If you are taking it, if it's every day, you take it at the same time every day. Because we want that the concentration of the medicine should be at a particular level, such that the virus will be suppressed. Okay. If you don't take it at the same day, the virus can change the way it is. You take the medicines and then they do not work for you.
All right.
So
you have some things to demonstrate here. Can we just go straight to that?
yeah. So this is, today is, tomorrow is Valentine. And you know, Valentine Day comes with a lot of fun. We are sharing, celebrating love and all that.
And affection.
Love and affection, and you know, and in doing this, especially for the young ones, young persons, people may want to have sex. And usually these festive seasons, you realize that people in the midst of the enjoyments and celebration, they kind of lose themselves and then
indulge a lot,
sometimes do a lot of things. And so my advice is that the young persons watching us, if you must have sex tomorrow, please use the condom. Play it safe. Very, very, very important for us. Your future is important to us, and so you need to protect it. So play it safe and use the condom. So I want to teach our viewers, and this is not just for the young persons, anybody watching us, that for you to use the condom, In fact, they usually come in 3s. So when you pick the condom, the first thing is to look for the expiry date.
So let's do it together.
So you look for the expiry date. Yeah, you can pick it.
So we look for the expiry date.
Expiry date, yeah. See whether expiry date is there.
So this is 2029.
So 2029.
Yeah.
There are some of them that they will put the manufacturing date alone.
Oh.
When you see like that, add some 5 years to it, and then you get the
add 5 years.
But these ones, for instance, most of them these days they don't do them like that. You have the expiry date there.
Okay.
And then the next thing is for us to ensure that this condom is intact.
Okay.
So when you press, you see that there's air filled in
air,
it. Yeah, and the condom is moving, it's movable. Okay. And before, let me go back. Before you even purchase a condom, please don't purchase it when it is directly under the sun. It must be in a cool place.
Okay.
So now, once you get the condom like this, you've checked your expiry date, all is well. And remember this, you open it to put on when the penis is erect.
Erected.
Yes.
So you
It
don't
must
open
be
it
erect.
before
You can't
the action.
open it and keep it. Yes.
Why?
And as much as possible, no, where will you put it? You may end up contaminating it.
Right.
So, but the condom should be handy, such that once you are ready, you just tear it.
Put in the condom.
Yeah. And as much as possible, when we want to have our sex, let us wash our hands and then do that. So then, in opening, you look at, there are 4 edges. One side is rough, one side is, so we will tear from the rough edge.
Okay.
And tear in such a way that the condom doesn't drop.
Hey, how did you do that so easily? Jesus.
Are you tearing from the rough or the
From the rough?
Rough, okay.
Yeah. Oh, okay, you're used to. Oh, okay, I get it. I get it.
Okay. So when you remove this condom, you need to look at it very well. One part of it is rolled up. It's rolled up. If you don't do it well, you put the other parts
down.
in.
Okay.
So once you want to do it, you see that they say something like the tip, like the nipple.
Like a nipple.
Please press that part. The essence of pressing this part is to expel air and also create space for the semen that is coming out. Okay. And so once the penis is, when you do that, you now just pull it in. So you roll it and then it goes. Okay. So you see that you have this place.
Oh.
If you wear the condom and see that this place is full, it means you did not expel the air. And then if the air is not expelled and then you trash in and out, it's going to burst. And then the purpose for which you are wearing the condom will be defeated.
Is it correct?
Yes, it's correct. Air? Yes, there's no air. So that's fine. So once it's like this, it means it's now ready for the sexual activity. So the man has his sex, whichever position he or she wants, whether doggy, whether the traditional one, whether wheelbarrow, whichever they want to have, then they can do that. But as soon as the man ejaculates, the penis must not be flabby before he comes out. Once he ejaculates, he has to come out.
At once.
Because if you allow the penis to fall off, you may remove your penis and the condom will be in the woman's vagina.
Oh.
Because it's erect that the condom is there. Once it becomes flabby, it's just going to. So once he ejaculates, he will just pull out gently. And then as much as possible, have either tissue, a toilet roll like this, or even if you don't have it, you have a small polythene bag, cover your hand. And then
you have to cover your hands. Okay?
Yes, we don't want, because the fluids in which somebody who is HIV positive, you find higher quantities of the virus. In one of them is the vaginal secretions.
Yeah.
One of them is the blood.
Right.
One is the semen. And then one is we also have the rectal fluid and then the breast milk. Okay. And so once it's in the vagina, all the outside is covered with vaginal secretions, vaginal fluid.
I get it.
Are you getting it? And so we don't know whether the person has a cut where something can go in. So we want that person to just protect the hand. And so you just, from here, it's wood, so it may be a bit difficult for us. But we'll still remove it anyway. So Once you cover your hand with it, then you remove it. We don't need to tie.
Mine is not coming out
because it's wood.
Because it's wood, yeah.
And you are not going to, these days we don't tie the condom.
Right.
Once you get enough of the paper and you remove it, just get any polythene bag, small one, put it in, tie it, and drop it in your dustbin.
Right.
Your rubbish bin.
Yeah. So from what I understood right now, the vaginal fluids can actually also be infected.
In fact, once the person is HIV positive, once the person has HIV, vaginal secretions, the semen, when I say semen, I don't mean sperm.
Yeah, I know.
Yeah, so the semen is the fluid that we see. So the semen, the person's blood, person's breast milk, if the woman, and then the rectal fluid, anal fluid, let me say that, for people who engage in anal sex, So these are fluids that have the virus in higher quantities. Okay. And so, so mother-to-child transmission is another key thing that we need to, because it's also another thing. But because we are celebrating Valentine, please, your condoms are very key for us. Use them, play it safe, and then all will be well for everybody. So that it shows that you are responsible, it shows that you are matured, and you cherish your future.
Right.
Yeah, so.
Thank you so much. It's really nice that we had this conversation. Thank you so much. We've learned a lot, but any final words? Yeah, my final words to the young persons, especially for tomorrow, is that please be responsible as you celebrate love. Be responsible, use your condoms. I'm going to leave some of them here. Come over if you are close by, pick some condoms, and then we'll be at West Hills Mall tomorrow to distribute the same self-test kits. And then so those around there, please come over to the West Hills Mall. You'll see us there distributing these things for you. And please, if you don't know your status, take the test. Because if you are a real man or a woman of substance, you should want to know whether you are HIV positive or not, okay? And then also take one for your partner, so that you live your life productively. And then together we will help prevent HIV infections in the country. Right. Yeah. Thank you so much. It was really nice having this conversation. Caroline Ado-Nadaga, who's the head of prevention, counseling, and nutrition at the National AIDS Control Program. I really had fun, and I hope you did have fun too. So please, Valentine's Day is in the corner. Remember to use your condoms. If you gotta play some, sexual games, remember to use your condoms. And also, do not forget to use your tissue, right? Remember, it can be on any fluid. As long as you have fluid coming out from, some parts of your body, please always protect your hand too. So you're not just protecting there, you're also protecting your hand. So, yeah, ladies and gentlemen. Anyway, let's take a quick break.